if I did have a product that magically reversed hair, I probably wouldn't be sitting here. All these women with hair loss, the one thing that they all had in common was their ferritin level, their iron storage level was less than 70. You put it under your tongue and you take it sublingually, you let it dissolve. Every time your hair goes through a cycle, these little melanocyte stem cells also cycle forward. But when the second sister stem cell trips, then you're destined to have graying hair.
Yeah. So I'm here today with Dr. Carlos Wesley. I was over in New York recently, and we didn't have, I felt, enough time to really get into you as the surgeon. And
I'm glad you're back.
I know, but everything that you're about, because you're very well known in the hair restoration world, and you keep your head down and you do your thing. And I really always, every time we meet, I really thoroughly enjoy our conversations. And I wanted to have the opportunity to sit down with you and for the audience to learn more about you and the practice, and through that conversation also your product line, which you've had for a number of years, but is certainly now at a point whereby it's going to be made much more available for not only your own patients, but other patients as well. So I want to say thank you so much for your time, Carlos.
My pleasure. And the feeling's mutual. I love sitting and chatting with you. I feel like I can just sit here and just
we never have enough time.
You go on and on.
Yeah.
But I'd love to chat about this and sort of the origin of the products, because this has been a 10-year process, maybe even more, maybe even 14 or 15 years. And we've never marketed our products. And the reason why is I wanted to make sure that they have the effect that they should. And of course, with anything that's going to stimulate hair growth, there's always the risk that it can have the opposite effect and can cause shedding and all these unwanted consequences. And so it's been a very gradual process over the course of many years to get it to a point where I really feel good about it. And it's truly something that can complement hair transplant, be an alternative to a hair transplant, because oftentimes people don't want to jump into having surgery. And I'll talk about that in a minute, but you asked about how things got started, and I do very much.
I'm interested. I'm interviewing different doctors in different cities around the world, and what I'm feeling is a really important component of the podcast and the educational element is. It's all well and good looking on a doctor's website and looking at his pictures and hearing about patient experiences, but rarely do they know about the doctor and how we got into hair restoration. And so I wanted to provide experts, not just hair restoration surgeons, anybody that's in the field that I feel can add real value to the educational aspects, which are really important. And it's different, it's new, it's kind of I feel relevant now because people want to know more, and people I feel want to know who the doctor is behind, the performing surgery, who what's he about, how did he get into it? So tell us how it all started.
So I can tell you that surgery was not my intended path. I don't know, this is a very niche subspecialty.
Definitely.
But I did know starting medical school that I wanted to be involved in the most important part of people's lives at that moment. That was something that it was always a focus of mine, but it really came about through stem cells. I always had stem cell requirements in college and in medical school. So at Princeton, they have a thesis requirement. We have to do independent research, and I studied blood-forming stem cells. And then in med school, Yale has a thesis requirement. So I focused on endothelial progenitor cells, basically vascular stem cells. And then through my training, I came across a dermatologist who had been doing some hair follicle stem cell research.
Interesting,
back in the day, Walter Unger. And I came into his practice, met with him, and he sat me down and brought me into the practice, and I just really enjoyed the artistry and the controlled environment of hair restoration surgery. And that really sold me on the experience, the way the days are run, the sort of the beauty of the procedure and the fact that you can really just lock in and focus on one patient a day instead of flying around and doing 50 different things
and changing people's lives.
Oh, and I didn't realize that at first. In fact, I was quite self-conscious starting in a field that's cosmetic because I had a very academic background in these institutions. Anything cosmetic is frowned upon. So for a lot of my med school classmates, I kept to myself what I had transitioned into because it wasn't traditional academic medicine. And over time, I obviously got over that because I took a lot of pride in how it made patients feel and how it really could look good. I didn't initially, I didn't appreciate the positive impact of that hair restoration surgery can have on people's lives. I actually did a lot of work.
Why would you? You're not a hair loss sufferer yourself, relatively. Like you've got a great head of hair.
That's very nice. Thank
you.
But
I imagine
product.
when you got into it at that age, I can only assume your hair loss was not a personal concern to you.
It was the scientific element. It was the aesthetic element. It was the personal
calling. It made sense to you.
I
it was
enjoyed.
Of interest,
And then patients started coming back, and we weren't that good at it initially. But then as it improved, you could see how it really impacted people's lives to the point where I had years ago done work in an ER, and that's very important. Don't get me wrong, and that's saving people's lives is critical, obviously. But I had more satisfaction with really impacting the life of a patient who it was really our connection and the intervention in their lives that allowed them to just get on with their days. And I had no idea that the ability to allow someone to just be and not think about something that bothers them so much would feel as good as it does. But it's been incredibly gratifying. And I can say that like amongst a lot of my medical school classmates who I love talking about what I do now, a lot of them, they appreciate obviously what I do and the satisfaction I get from it, and it was a really wonderful choice.
I think that's really interesting because every surgeon's story is different, and listening to different surgeons and hair restoration experts kind of confide in their journeys into this, and they're all different, and it makes complete sense because I think obviously the route in, despite different, it all has this kind of effect on people when they realize that it can have such a profound effect on people. You can change people's lives. And you said in the ER room and working in ER or in emergency situations, that can be pretty grueling. I can only imagine that day in, day out, despite the fact that's rewarding in itself. But it's from my perspective of speaking with different surgeons who've all had different routes in, they've all experienced different aspects of medicine, medical care, and it's a natural progression and a natural route. It's like I didn't set out to become involved as patient advocacy and hair loss when I was 20 years old. It was only at that point that I started to lose my hair, and it's only over the last decade that really I felt, gosh, I've really been able to help protect people and change people's lives for the better so that they don't have to experience what I personally went through. And after speaking to countless people, thousands of people, it was evident that so many people still making so many mistakes because of the nature of this industry, that it is, we're fortunate to have surgeons like yourself that are so caring and are so passionate and really want to impact people's lives in a positive way. And not just aesthetically, but the whole process of meeting that patient for the first time and taking them through that whole journey is a calling. There's something special about it. And once you've experienced that and you've witnessed how you've affected somebody's life for the better, it's like a drug in itself, isn't it? Because it's like I as soon as I realized how much I was able to help people, it only motivated me more to want to do it more.
Sure.
If that makes sense.
Of course,
So,
yeah.
and hence we're here today. I didn't set out to be, helping provide people information via a podcast and interviewing experts like yourself, but we're here.
Here we are.
And that is
That's
life.
now.
That is life. But just to kind of expand on that then slightly. So obviously you were trained under Dr. Unger, and then you've obviously run your own practice. You've been in New York for the whole duration.
19 and a half years now.
Yeah.
It's been a very long
Yeah.
time. And I can tell you that it's not just myself, but my whole team has been together in the OR for 19 and a half years.
Yeah.
And
That's amazing.
That's really important. I do the surgeries, but at the same time, knowing that the systems that we have are so reliable when we're dealing with thousands of grafts, just to know that I can trust every aspect of what's being
Every
done.
cog. Yeah.
It's like any sports team. Like the best champion sports teams are the ones where you do your job. You focus on your role.
Yes.
You do your role really well, knowing that everyone else is going to do theirs, and magically things come together to win championships. And the other nice thing about that is, because we've been together for so long, we want to get better. I mean, we as a team want to get better. I take the whole team with me when we go to important meetings. When we want to learn.
That's not a cheap
yeah.
tab.
I'm debating if I should do that. No, but it's nice. I mean, it's a great experience for all of us. The first time I was a bit skeptical because we went to Prague. We went and I was just a little skeptical that it would be a vacation with your workmates to a European beautiful new city.
You got to have some fun as well.
But they were all the first ones there at each lecture, and they really want to learn.
Brilliant.
And it was beautiful for me to see that. And all of us together want to get better. It's so fun looking at our results and knowing that they truly are improving.
Yeah.
And each year we want to take on new little nuanced improvements and see if additively it does make a difference. And having a team that really wants to get better is
that's a testimony to you,
difference.
because I'd hazard to guess there's not many, if any, clinics, practices that have had a team consistently for that amount of years.
Yeah, I feel very blessed. I really
working
do.
in one place because of, just the nature of people move, people, have children, people, the different variables that are in place. And I'm sure that's occurred over time with you, but the fact that you've kept that nucleus of staff together at your clinic is a testimony to you. And just to talk about your practice, we've met a few times, but a couple of years ago, I came to New York and we met, and I came up to your old clinic and we spent a couple of hours together. You showed me around, and as I was leaving, you said, "Have you got 5 minutes?" I was like, Of course. He goes, "I really want to show you something." I was like, "Okay, cool, man, let's do it." We hopped out. Meanwhile, it was on Park Avenue. I remember you went down into your original office. Was very bespoke, very small, dug down, and it was a beautiful building, but it was kind of like all underground and at the bottom of this building. But then you were like, "All right, let's just walk up." And I'm walking up, and I see the Guggenheim. And I'm like, "This is insane, buddy. I didn't realize we were so close to the Guggenheim." And he goes, you were like, just let's go in here. And you open the door up, and it was this incredible space, this massive kind of, tall buildings and everything that you were then, this is going to be my new office. And I was like, shut the front door. This is insane. And at the time, it was an old lawyer's business, wasn't it? And it was
two hand surgeons that were retiring.
Oh, beg your pardon. That to expedite that, now you are in this new office, which is literally on the corner next to the Guggenheim. I was fortunate to, a couple of months ago, I was in New York when we saw each other again. I came round the new clinic, so I was super excited. I told you I was in town. You were like, "You've got to come and see this place." And tell us a little bit more about that, the clinic, and how that transition's been, because it's a much larger space. You've worked tirelessly on this. It took a couple of years minimum, didn't it? I remember the whole planning permission around the building, but this location is insane in terms of where it is.
Is great. The office, we love the office. It's definitely our new home. Initially, it was just a new facility, but it's on the corner of Fifth Avenue and 88th, looking out at the Guggenheim.
And Central Park.
And Central Park. Actually, one of the other aspects that I love is in the middle of the day when I'm just doing my thing, the staff goes out and walks around the Jackie Onassis Reservoir, so they get their little fitness in. But it is exactly the feel that I wanted to create when people walk into it. It is very elegant, but it's also very welcoming. It has lots of wood and curved. It doesn't have sharp edges. It's not sterile. It's inviting, and that's really what we wanted to create, was something that people just feel warm when they come in. It's unapologetic. They want to address their hair. They're already feeling somewhat self-conscious, and then they walk in and it's just a feel that I wanted to establish. And the flow of the office, it's nice having been in the field for a long enough time that we knew exactly what elements were needed to streamline each day. It's a big space by New York standards. I think everywhere else.
I mean, no doubt.
We can extend our arms and not touch a wall.
Or the ceiling.
Wonderful features like that. But every patient comes in now and they just say, "Oh, this is nice," and it just feels good to know that it's something that really represents us well. Much better, as I've mentioned. I probably spent 100 times more on our actual office than on my website. So I think that one is a great representation and the other needs a little work. So
you're fortunate that you have a healthy waiting list. But one thing I just want to remark on as well is the, after going round, I've been around a lot of clinics, and it is, despite its postcode, its zip code as you call it, and it's just the elegant nature of it. It's a fantastic place, and it represents you well and all the hard work that you've clearly put into it over a number of years, because it was a project I know, having seen it as quite literally a building site, and then literally seeing it finished in that relatively short period of time cannot have been easy, whilst meanwhile still doing surgery and trying to facilitate and run the business and what have you. But I must draw attention to and comment on the fact that when I walked in to your office, I was so overwhelmed that you had housed the Apes Gentleman logo behind the counter, behind the reception. And at that point, when I first witnessed it, I was like really blown away, but I had then time to process it, and I had to make a quick reel of it, and as I was videoed the whole kind of office, and we did a brief interview. But then retrospectively, when I put it together and I put it out that I'd visited you, it was quite an overwhelming response that I received, and I think it's really important that this is discussed, because unbeknown to you, you'd had that foresight, because you have been kind of aware and a part of the Apes Gentleman, but the kind of profound effect that article, The Best Hair Transplant Surgeons in the World, has had on helping educate patients. And you felt it so important to house that logo so proudly and so prominently in this office, which was, you didn't have to put it there after the gosh knows how much money and time and effort you'd put into the attention to detail of the office is insane. So I was humbled, and Apes Gentlemen were, at the fact that you'd housed that so prominently. And as a result of that, the Apes Gentlemen were inundated with doctors saying, where can I get one of these logos? Where can I get one of these plaques? And they've subsequently now provided surgeons all around the world. This isn't a replica of your one, but now surgeons around the world have got this one that is in their offices because of the powerful kind of element that's brought, because you proudly supported that. And I'd like to present you with that one for your office, even though you had the original, and well done.
That.
And as a result of that as well, this is just another sidearm that now in doctors' offices, they have this, which is the Apes Gentleman kind of article, and they can scan the board, and it takes them straight to the article, which enables them, whilst they're sitting there waiting for a consultation with their surgeon of choice, can read the article. So if you wouldn't mind telling us just briefly what brought it about, you considering all the things, all the awards, all the qualifications, everything that you have, as you just said, and humbly, Yale University, you've got such a pedigree that you've housed this Ape Gentleman article so proudly and prominently in your reception.
I mean, it just makes sense. I think of all the different bells and whistles on the internet, it's hard for a person to know what is worth listening to. And I feel like this is something that just breaks through for me, for patients. It's just it just makes sense, and I think it is the aesthetic of it, the concept, the fact that it's global. It's really something that's looked at universally at all the different practices and how we fit into that. To me, it's just something that represented our office better than any of the others. And so that's why it's featured so prominently. It's the first thing people see when they come to the desk, and they see it right there, and it just made sense. It was something that I feel great about. And I want our patients to know. Well,
I'm really so so it's flattering to hear, because I recently did an interview with Chris Beastle, who's the
I hit our plaque for the worst hair transplant doctors. I didn't want that to be seen.
You hit
as
that one. Yeah. Well, I'd like to see that list. But Chris at Ape Gentleman, we discussed what an effect the article has had on the community, and the fact that it was never really built or designed. They were interested because of the search terms that were there, but we didn't realize the kind of incredible effect this would have in terms of educating patients, because it's a list of surgeons, certainly, but more importantly, it's the content within it. It's an 8-minute read that enables patients to have a perspective that they wouldn't normally have, because it gives them the facts, and it gives them an understanding, and enables them it pushes back a little bit on them and enables them to do their own due diligence. And then once they understand the multiple moving parts of hair restoration surgery, and that hair loss is progressive, and you don't just get one surgery, and the fact that my story is in there because I helped write the article, but it shows that it puts a little bit of a roadblock in the way of okay, this isn't just as easy as I thought this was going to be. So the fact that then, I didn't realize, because I just thought I could go to anywhere and get a hair transplant, and they were all kind of the same kind of thing. It's like a cookie cutter type of procedure. What this article has done is it's enabled to put the responsibility back onto the patient to question, and then in turn puts them in touch with different surgeons all around the world, not necessarily to have surgery with, but to get a really good informed ethical appraisal on their eligibility, and understand more about hair restoration and hair transplantation, because as you're sure you'll agree, it's made now with the light of the internet so too readily available. It's made out to be such an easy process. So and obviously there's such a price war going on with people schlepping off to Turkey because it's cheaper. And what this article has enabled people to truly understand is there's much more to it than that. Would you agree?
Oh, absolutely. And first of all, we're very fortunate to not be affected by that industry in our practice, but I feel like there's the obvious before and afters where everyone can look on the internet and see what looks the best to them. This is really sort of the nuts and bolts about the details of each practice, the information that maybe is different between each practice, and then this is the people, the personalities behind it, and the stories behind it. Yeah. And I think that those elements are really the best way for someone to feel good about making a choice if they take the time to do so.
Yeah. Well, those elements are enabling us to protect the patient, I find. this is what this is about. And the surgeons that I work with, as part of everything that I do, as part of my another arm, Specs Hair, which is how my story originated. I was Specs on the forums, hiding behind a pseudonym, and then as it evolved and my story became public, and then I wanted to continue, which was much like a blog of just sharing information, is everything has evolved, and I can only be thankful that surgeons such as yourself have helped resources like Specs Hair and helped resources like H Gentleman evolve with your support, because it's essentially like a collaboration of there's no kind of us and them. It's like everybody is in this together, and if we can help, essentially, it's not to direct people in one certain direction, but if we can kind of remove the veil and allow people to just understand this much easier, then they're going to end up with a potentially much more favorable outcome. And as we know, it's very easy to have an unfavorable outcome with hair restoration.
Sure.
Yeah. So.
Oh, and it bothers me when I see poor work done elsewhere, because people assume that's the way it has to be done. And so oftentimes people are just not great candidates for the surgery, and they shouldn't be told that they are. And that's where a lot of the products came to be.
Yeah.
Because years ago, the only approach that we had was the strip harvest, and oftentimes that would commit patients who really shouldn't have to wear their hair short to wearing it, shouldn't have to wear their hair long to wearing it long.
Indeed, yeah.
And so then I realized that there have to be other offerings to not just say no to a patient, but to be able to say no but, or an alternative to surgery is this. And oftentimes, even if patients are pretty good candidates, they may not be interested in surgery at all, and they still need to, but they still want to know what they can do.
Well, what's really important, and this is what the article is about, but what we're about as kind of professionals in this field, people don't truly understand that hair loss is progressive. So, and surgery should be the absolute last thing on the menu, And before that, it's like there are so many ways to help so many different individuals whose hair loss is all relative to them in different stages, different ages, different sexes, that you have been so aware of that and want to help patients, that prevention is the cure. So if we can get information to patients earlier on in the process,
that's very true,
we can prevent them even having to venture down the surgery route. So in light of that, and I'm really excited to discuss this product range of yours.
I'm excited too.
Yeah, I know. But why I am, because a couple of years ago when I came to your clinic, you provided me a range of products. And my wife was very keen to use them. And she used one in particular. I can't remember which one it was. And when she knew I was coming back to see you, she said to me, please, can you get some more of that shampoo from Dr. Wesley, because it was fantastic. And I said, well, I think we'll be in luck, because I think he's expanded the range quite significantly. And one in particular that I've got to get from you are those gummies, which delicious. I want you to explain more about. So tell us about how this came about, because I know this came about by treating your own patients with this treatment regime on different products and different things. So please enable the audience to know a little bit more about this.
So the reason why I'm excited to talk about it is not because I want them to fly off the shelves. We've had it for many years, and we've never marketed in anything before. The reason I'm excited to talk about it is because they really do work. Yeah. And so years ago, patients would come in, men or women, oftentimes women, and I would go over all the different supplements or things that they should go gather and fill up their medicine cabinets, and it was very cumbersome. So I realized that if we're talking about surgeries of 2,000, 3,000 follicles, that's all well and good, but there's 40 or 50 or 60,000 up there. If you can stimulate those to come back, you're going to have a much better outcome. So when I start a consult, because hair loss is so nuanced, because there's so many variables that influence hair loss, because it's so complicated, I actually like to really simplify things and say, in general, there's two fundamental approaches to combating hair loss. There's the surgical approach and the non-surgical approach. The non-surgical approach includes pills, topicals, PRP, exosomes, all of those things. And that tends to work best in these regions, the crown and the mid-scalp. They don't oftentimes work as well in the front.
Yeah.
Surgery is really the only way to reestablish a framing of your face. If the front's most important, that's the surgical approach. Surgery can also help in the crown, but it's kind of the only way to get the results.
Especially
that you
after
want
it's gone, the front is kind of already miniaturized. It's a harder fight.
Yes, that's absolutely true. So that simple statement kind of lets people know if these areas are important, then they don't necessarily have to jump to surgery to get results that are maybe just as good, maybe not as good, but have some progress. So then, again, men and women, oftentimes more so with women, because again, it's a generalization. Men, it's pretty simple. There's a hormone and there's genetics.
Yeah.
With women, there's more variables and
many more. Yeah.
And
unknowns even.
And I always refer to the 4 pillars that are required for healthy hair growth. There's hormones, there's nutrition, there's the environment of the scalp, and there's the cell cycle. When hair's in the anagen phase of the cell cycle, it's growing. When it's telogen phase, it falls out. So those 4 pillars are really important. If any of those are compromised, then you can have hair loss. If more than one is compromised, more than one of those 4 pillars is compromised, you can have dramatic hair loss. If you can optimize those 4 pillars, hormones, nutrition, scalp environment, and cell cycle, then that's what allows you to really have healthy growth. So when someone comes in and they're interested in more hair volume, or they just want ease of styling, or just more coverage overall, that's when we really focus on non-surgical strategies. We don't even really talk about surgery. And so with these different products, because the other thing I realize is you can use a topical, particularly topical, that's the perfect topical blend for you. There's the Finasterides, the Minoxidils, all those things, and it can be working beautifully for 3 months. It can be working really well for 6 months, and then it kind of plateaus. And then the benefit starts to fade a little bit. You're like, wait a second, what's going on? I'm using the same thing and it was working so well for me. But that's not uncommon because, again, with hair, it almost needs to recognize something new in order for it to be stimulated. And so that was my motivation for having lots of different
approaches to it.
Different influences on hair. And so the nutritional... I love these. And I can tell you, we've had so many different iterations of
these. They're the gummies.
These are the magical gummies.
Yeah, but they're the predominantly like very iron. It's a combination.
Yeah, so it has the most easily absorbable type of iron. Yeah. And that's important because there was an article in the New England Journal about women's hair loss, and they looked at over 400 women, and they all had hair thinning. And the one thing when they did the blood work, all these women with hair loss, the one thing that they all had in common was their ferritin level, their iron storage level, was less than 70. And that's important because if you go and get your blood work done and you check your ferritin, Ferritin, it's going to be normal because the range of normal is very broad. It's like 20 to 220. But specifically for hair, it should be greater than 70. So very often with women, we'll have them look at their ferritin level and it's below 70. You need to improve your iron storage. You can do that with iron infusions. Oftentimes people don't want to do that. So then you can look at iron supplements. But the problem with iron supplements is they can be constipating. They can taste horrible. And so...
the absorption. Am I right? You can take an iron tablet, but it might not necessarily be getting absorbed.
So this has the most easily... You're right. This has the most easily absorbable type of iron. It has vitamin C, which helps iron absorption. Then the problems where it tasted gross and it turned green if it was in a capsule, which looked like something was wrong. So over the years, we've developed iterations where it tastes better. But each time I wanted to look at different clinical studies and incorporate elements into it that would really help with hair growth. Inflammation is also a underlying cause of hair loss in women with just normal genetic hair loss. There was a study at Cornell where they took women with just genetic hair loss and they did scalp biopsies. and they found at the stem cell containing region of the hair follicle, there was an increase in inflammatory cells. So there's an underlying inflammation as well, even when there's no pathology really. It's just genetic hair loss. So this then has it has an anti-inflammatory that's derived from fern. It's called 5-loxin that also helps bolster hair growth because it focuses on the pillar of environment. By environment, I mean scalp environment, like inflammation.
Yeah.
So,
and these are for men and women.
Yes, they're for men and women. This is a little better for women because of the inflammatory aspect.
Yeah. They're the ones my wife likes.
These, I take both of them. These are more for men. They have all the elements except the anti-inflammatory component.
But they're not a gummy, are they?
No, these are dissolvable tablet. I'll have one with you. Oh. I have one each day. I haven't had mine today. You can have yours and I'll have mine.
Awesome. They just dissolve.
Yeah, they're so simple. It's just like a citrus flavor. And it really does work. But the gummies, my wife takes them. That's why I have such a good relationship with my mother-in-law.
Flavor.
There's allowed her to grow her hair back. Now,
they're one a day. They're predominantly like one a day as part of your regime.
It should be 3 a day.
Okay.
Technically, to get everything that you need with the gummies.
I mean, yeah,
you can have one here.
The one that you just given me. Oh, here we go.
I'm risking this. You're on air. Let's see what your reaction is. It's risky.
I'm going to look like David Hasselhoff in a minute.
But this is something that now I feel so confident.
You're not going to wash my hair in a minute, are you, on camera?
That comes next, yeah. I feel so confident about these because with a lot of drugs, a lot of pills, a lot of topicals, sometimes you apply them and you can have shedding. And that's something where people just lose faith. They say, no, I've been doing it for 2 weeks and I have a lot of shedding.
Yeah, they panic.
So starting them with these nutritional supplements, if I'm starting a man or a woman on medication, I'll have them take these for a couple weeks at least. So they don't cause shedding. You can start to see improvement within a month, but it's strengthening the root just a little bit. So it allows you to, when you're going to have a medication like Minoxidil that shifts your hairs into the growth phase, it minimizes the risk of shedding, and you're more likely just to have growth.
You're strengthening it from underneath, aren't you?
Yeah.
You're strengthening the environment, and on top of then, I get it, because notoriously with Minoxidil, or notoriously with most hair loss products, there is an initial shed phase. Much like, because the hair is like, whoa, what is this? I'm going to reboot. And that process is normal, but people do panic.
Yeah.
Very much so.
And
then they stop. And then the stop, start, then is also compounds the issue. So that's interesting to know that element is start on this and let's strengthen it initially. And then let's look at how else we can address it.
It's a way to set patients up for success. So, because once they, and taking their own baseline images, once they see the improvement in a month, 2 months, particularly 3 months. I mean, everything with our shop site, we have subscription models that are for 3 months worth of product, because at 1 month you may not see a whole lot. 2 months you can, but at 3 months is when I feel good about having patients really evaluate their progress. And so our subscription model is because you want to have a sustained treatment. But you also want to commit to 3 months to doing something.
Yeah. There's no point just doing a month, is there? They're like, quite literally.
Not with hair. No. It's not orthopedics. No. I mean, it really does take time. Unfortunately, the shedding can take the shedding is very dramatic and precipitous, but the growth is something that definitely takes time.
The best analogy I give to people with regards to hair loss treatments is it's much like brushing your teeth. Okay. You don't just do it once and that's it. It's like, it's got to be done. It's habitual. It's got to be done daily.
I've never used that. Okay.
Well, I'm surprised you don't already.
I say it's like going to the gym, because people say, do I have to use this for the rest of my life? No, it's like going to the gym. You go to the gym, you see the results, you're buffer, you're more fit. You stop going, well, you sort of go back to your baseline. You're not worse off necessarily. You just lose the benefit that you had gained when you were there.
But you want to brush it, like use the analogy of the teeth, because it's essentially, if you want to maintain the health of your teeth, much like you want to maintain the health of your hair, it's got to be a consistent kind of regime that you continue with. And if you stop brushing your teeth, you're soon going to lose the benefits, and other issues are going to occur, aren't they?
Yeah.
So tell us a bit more about now then the range of shampoos, because there's a variety of different ones that address different elements of
Sure.
the hair itself.
So I use these. This is my regimen is I use my ketoconazole based shampoo Monday, Wednesday, Friday. I use the zinc parathione element shampoo Tuesdays and Thursdays. And then there's a volumizing shampoo and conditioner I use on the weekends. And that is the truth. That is my regimen. Today is Monday. So this morning I use this. And I also followed up with the conditioner. But the ketoconazole shampoo has the three sort of building blocks, if you will. It has ketoconazole, it has saw palmetto, it has caffeine. I guess they're not really building blocks, but they're three very positive influences on hair, and it contains each of those.
On the scalp environment.
Yeah, I mean, ketoconazole in a way is an anti-androgen. Caffeine, all of these things have been shown to have a positive influence on hair. Yeah. The zinc parathione is something that's been shown to prevent shedding. It really can slow shedding. But I find this best for volume. I mean, I truly can feel the improvement in volume when I use this. The volumizing shampoo and conditioner, that's more focused on hair cuticles. Yeah. If you look at your hair under a microscope, it looks like a little lizard because it has all these scales that are the cuticles. The volumizing shampoo can kind of make those stand up a little bit and give the look of more volume. Yeah. And conditioners oftentimes can flatten them to give it more shine. But that's the impact of those. So that is my regimen, and it has a protective effect on hair. But the topicals, we work with a formulating pharmacy that we don't make our own topicals, but there's a great formulating pharmacy that's been doing this for over 20 years. And so when patients, there's a range of different blends for both men and women that do help drive hair growth. For men, there's different ranges of just finasteride if people are concerned about sexual side effects, because the idea with topicals is you can apply them on your scalp and you don't have the systemic absorption if it's done with a liposomal form. I don't want to get too boring, but it's that is important. There's a whole bunch of topicals sold now. You hop online and you click on anything hair related, you're going to get bombarded.
You're going to be in the algorithm
by topicals. But the key is it has to be liposomal, and what that means is there's different formulating pharmacies that have these machines, like a $250,000 machine that takes a molecule like finasteride and puts sort of a lipid component to it. So what that does is if anything liposomal, if you put it on your skin, it stays there. There's a 5 times increased concentration of that intended drug where it's supposed to work, or on their scalp. It's 5 times increased concentration of it there, and it doesn't get absorbed systemically. So it's more effective, and you don't have the sexual side effects that you have with other topicals. And I only know that a lot of the ones that are out there are not liposomal because the group we work with, they did the analysis and they can see very clearly essentially it's finasteride dissolved in a solvent like saline. So with men, we have a range of the most benign, just finasteride containing versus the kitchen sink, if you will, which is finasteride, dutasteride, minoxidil, retinol, caffeine. And for women, there's spironolactone and estradiol. There's different forms of estradiol and minoxidil. They're very different, men and women.
There's so many different things out there, without a doubt.
And it's a little overwhelming, but we have a way on our site to walk people through what's right for them, and I feel good about it because again, like one of the things as a consumer is there's so much information, and even when you choose one site like our shop site, you're like, oh my God, now I have this whole range of topicals.
Which
and
one's
shampoos,
for me?
And so there's strategies on our site where you can again focus on those 4 pillars. Yeah. Where, say, this would be something that takes your nutritional up to a degree, maybe inflammation up a degree, but it doesn't do enough for cell cycle, and so this would be something that bumps your cell cycle up, and you can choose products. So when you check out, you've optimized all 4 pillars based on kind of like Dungeons and Dragons, where you had all the different charismas and intelligence.
Yeah. So you bespoke it to the patient on the website then, and it enables them to choose what potentially best products for them.
It really simplifies something that's very complex to know that when you're checking out, you're purchasing something that is really optimizing those 4 pillars, and each of those will complement one another, as opposed to just buying a bunch of the same thing that's not really going to have the best possible effect.
In this range, because a big factor around hair, and something I'm personally now starting to experience, is graying hair. And it's like, it's coming thick and fast, and it's like, whoa, okay, so it's what is this?
You're getting wiser.
This is the natural process. But is there anything in this range out of interest that helps address gray hair, or is that something that you would consider? Because obviously such a massive kind of concern for people, that not only now have we been through this whole process of getting our hair back, as I have over the course of all these different surgeries I've had over all these years, now I've got a new issue to deal with regards to it, that it's now going gray, which is a process, which is a natural part of the process, aging process. But if there's any way to intervene with that, then I'm all ears.
So not exactly. And I can tell you, if I did have a product that magically reversed hair, I probably wouldn't be sitting here.
I know, but there's got to be a way to help prevent it. Do you feel there's a way to help prevent it?
Yes. And so with graying, it's a very complex process, and I won't do it justice, but I do know that there's 2 sort of sister stem cells with each hair. Every time your hair goes through a cycle, these little melanocyte stem cells also cycle forward. When one of them, and they're always totipotent, meaning they can continue to cycle and produce healthy hair. When one of them trips and is committed to it being its last cycle, you'll still have one more cycle with coloration, but when the second sister stem cell trips, then you're destined to have graying hair.
Yeah.
So they've been able to identify at least that much. What I can tell you is we do see coloration come back. The melanocytes be reactivated with some of the topicals, because they're focused on cell cycle. With PRP, I mean, that's something you can use your own platelets. And that's something that we have seen, that hairs that are somewhat transparent, about to become gray, that coloration can come back, because the melanocytes can be reactivated with PRP, and we do see that with the topical at times. But the mechanism is kind of understood, but not really. But that's sort of the nuts and bolts, just to tease you that you now know something about it,
and then
helpful. You walk away and say, "Wait, what?"
That's helpful to know, because it's something that
it's almost helpful. It's almost
helpful. But obviously, Doc.
But we do have fibers.
Now this is now
something.
Tell me, because obviously the original, I've not used them for years, but obviously I used to use the original kind of Topic fibers. So and there's so many different fibers on the market now. But explain a little bit more, because I can only imagine that helps a lot of patients.
Sure. When you the keratin fibers, when you have an event and you don't want to wait 3 months to look your best,
of course,
and you have some photo shoot, or you're going to an event where you just want to look fuller, the idea behind the fibers, and their coloration is based on your color hair.
Match your own colorway.
Auburn, dark brown, light brown, medium brown, blonde. This is salt and pepper.
Do you do a gray one?
Yeah.
I'm gonna need it.
You're a long ways from that. But the idea is it sort of provides a shadowing of your hair. So if you have any hair there at all, and you apply the fibers onto your scalp, they stick to your scalp.
They magnetize,
and it gives the look of having much more hair volume, much more hair coverage, because it's breaking up the color contrast between the color of your hair and the color of your scalp, so it blends in and just looks like you have more hair volume. So this is something that patients like, especially dark hair patients, they see a profound improvement, because there's a lot more color contrast between dark hair and light scalp, but that works immediately. And so ultimately, you can use this and then graduate from having to use it if the products are working in a way that's really growing your hair back and giving you your volume.
Definitely.
So that's
it all works,
on here. But
it all works very synergistically, without a doubt. If you don't mind me asking you a personal question, in light of you use this regime, you've got great hair.
That's nice. Thank you.
But do you take anything else? Have you been taking finasteride, or do you apply anything else? If you wouldn't mind telling.
Yeah. So one of the beautiful things about my profession is I get to learn all the things that I can tell patients about, but then apply them to myself. So I have used finasteride a lot in the past for many years. It was working great. And I've used minoxidil for many years. It was working great. But with both of those, I encountered times when it was having an effect on me. I can tell you with minoxidil, the pill, I started swallowing it right away. It was working well, but then I got strangely really severe gastritis or ulcers.
Right, okay.
And I was talking to a endocrinologist friend of mine, and sure enough, that was one of the lesser known side effects of minoxidil. And so I didn't use it for many years, but I knew it was really effective because I saw my patients benefit from it. So now I use a lower dose and I put it under my tongue.
Oh, yeah. So tell the audience about this, because we had an interview. We did a remote interview about a year ago, and it was a really interesting topic that you brought up that I was not aware of after being a finasteride user for years and in the industry for so many years and spoke to so many patients on the medication. And you came up with this.
I didn't come up with
it.
I just listened.
You raised my awareness to it. Not that you came up with it.
I listened
but
to
you raised my awareness
to
the fact that there's the way you take it can help mitigate side effects.
So minoxidil, if you take the same pill, but you instead of swallowing it, you put it under your tongue and you take it sublingually, you let it dissolve. Then the efficacy is about the same, maybe a little better actually, but the risk of side effects like palpitations, headaches, those types of things are essentially eliminated. You don't have those types of side effects because it bypasses first pass hepatic metabolism. So it's metabolized in a very different way, so you don't have those types of side effects. So now I do take minoxidil, I put it on my tongue, and I've been totally fine. The other one was finasteride. I've been using that for many years. I have 3 very healthy boys, thankfully. But there was a time, and I don't know if people call this brain fog, the way I would describe it is I was walking home through Central Park. It was a beautiful sunny day. Everything was going well. The practice was thriving. I was out early. Good. And I just felt like there was a ceiling on my happiness. It was a really strange sensation where I know objectively I should be feeling this.
Okay, that's interesting.
But I was just kind of feeling this, and it didn't make sense to me. I was healthy and doing exercise, all of those things, and I had just kind of used a different form of finasteride.
Okay.
And I stopped finasteride, and that went away. But I knew that for me, it works really well. So then what I started to do is use my topical finasteride, dutasteride, but take a smaller oral dose. So use even a half or even a third of a pill. But again, it's the beautiful thing about having my own practice. We do a type of mesotherapy with dutasteride and exosomes where it's an acoustic sort of vibration sound wave that creates little air bubbles in your scalp. It's so comfortable. It feels like a head massage. But my staff does it on my head where they massage your head with this little device. It's sort of a vibration. It feels like a massage, but it also...
It's not penetrating the scalp
It's
at all.
needleless.
Right,
There's no needle, but the movement is something that creates little air bubbles, about 2 millimeters in depth. And that's important because hair follicle stem cells start about 3/4 of a millimeter from the surface. So they start here, and it's capturing this much. So that it does penetrate where stem cells are in your hair follicle. It has dutasteride, and it has... exosomes. It's a low dose of exosomes, about 5 billion, which is not much. You can do 100 billion or more. Right. And then there's a vitamin complex as well. But that is something that I would do monthly. My staff does it on me the 11th of every month, more or less, because the half-life of dutasteride is 40 days.
Yeah.
So that's why doing dutasteride mesotherapy like that makes sense to do it monthly. So my patients who are nearby, who are maybe it's not a big deal for them to come in and do that and go back to work right away.
Yeah.
You can totally go back to work. It feels completely normal. It really is like a head massage.
Yeah,
it looks great. But that's the other element of my regimen with my hair. But I can't
quite
do
comprehensive. Then.
Yeah, it is. I tell you, if I weren't in this field, I wouldn't do that.
Yeah.
But it has allowed me to navigate around some of the kind of annoying potential side effects of those medications and still have the
benefits of
the growth, actually the hair growth. So these are real. Those are real.
Well, evidently, and I mean, it's we unfortunately got to wrap this up. But what has been fantastic is just to spend time with you, and for the audience and the listeners to gain a much more awareness of what you're about, and not only what the practice is about, but what you've been working on tirelessly for many years behind the scenes that's been provided to only your patients that have come to you, but now you're enabling people to get this that can, that don't necessarily have to come to you. You've created a new website that's coming out soon that's going to enable people to get benefit from this treatment range. So, Doc, it's been incredible. I want to say, firstly, thank you so much for all your support over all these years.
Yeah,
we've known each other, I think, over a decade. We've worked closely together for the past several, and it's having surgeons like yourself on and your stories that enable us to just create a safer environment for everybody and for everyone to get really well educated and informed on hair loss. So thank you very much, Doc.
My pleasure. Thanks so much.
No worries.
I really enjoy speaking with you.